previous day. So, see, the most challenging for a homeopath. I know you are in final year and next few months you will be licensed doctors. Okay. So, what do you feel is the most challenging thing in a clinic? I appreciate the smile on your face. Next few months you will be legal practitioner. Fine. And I am also asking you a very difficult question here. What do you feel will be very tough as a doctor when you start practicing? Assuming you start practicing, what do you feel is the toughest challenge, or what do you feel is the difficult task? Huh? Giving, okay, very good, giving instant relief. So which are those cases which require instant relief? Who was that? Acute cases, very good. So acute cases require instant relief. From whatever you have read in your organon, from the knowledge of medicine, you know acutes require immediate attention. If you don't treat acutes on time, so what is the worst possibility? Many times we can lose the patient as well. So Dr. Haniman says it either ends in recovery or death. So it's a very serious situation. So today we are going to talk at a very simple remedy, a very acute remedy. I'll start with a case, and through the case we will try to understand the remedy I am going to discuss. Okay. And Bangalore, now you all see that we have a lot of seasonal flu. Okay. Lot of fever cases coming to our clinic. Okay. So we had one such case. We had a 35-year-old gentleman, okay, who had come to my clinic, and he had fever. Now, what remedies can you think of? Very good. Belladonna, aconite, gelsemium, arsenicamol, bacteria. Now, how do you decide? See, I mean, when I gave you this situation, I expected a question, but before you asking me a question, you started with answers, and you came to a conclusion very fast. So what would have been a better way of looking at this particular scenario? You would have asked me, sir, see, this is not allopathy, this is homeopathy. So when a person comes to you with fever, you cannot straight away think of belladonna, you cannot straight away think of gelsemium. How do you decide if the given case is belladonna, gelsemium or whatever?
Duration.
Okay, so you will have to mainly look for the symptoms. You will have to ask him, if it is fever, what is it that he is complaining of? Fine. We have an acute totality, we have an exciting cause. All those things have to be taken into consideration, and then we have to decide, or then we have to conclude the remedy part. Okay. So what you need to understand here is, so when a gentleman came to me with fever, ideally a final year student should have questioned, sir, what were the symptoms? Okay. So based on the symptoms, we come to the conclusion if the given patient is the remedies that you told me, belladonna, bacteria, gelsemium, whatever. I have no issues with the remedies, but I want you to understand the process. Okay. So now I will give you a little more details of the case, and then we will see if we can come to a conclusion. So this gentleman, he had fever for last 2 days, and then he complained of severe body pain. He was very chilly. He was covering, that's why fan switch off karo. He was covering himself, and he also had vomiting of food, vomiting of water, and he had increased thirst. So this is the small totality I got, and then I prescribed a remedy, and that is the remedy we are going to discuss today. Okay. Now keeping these things in mind, now can you talk of a remedy? Okay, China horse, yes, very good, possible. China horse, what else? Eupatorium, Perfoliatum, very good. Vijaykrishna. Okay, China, only China. Okay. So your friend gave China horse, now he says, sir, take only China, and you can also take arsenic. Okay, and then we'll combine it as China horse. See, China horse is a beautiful remedy, especially for fever. Now what is that speciality you have in China arts? Okay, I mean, many remedies are chilly. China arts is also chilly. But what is very, very characteristic is periodicity. Things coming at a specific interval. Periodicity. Okay. Now that is very important in China arts. And China also has a good amount of weakness. Okay. So when you have a person who has got weakness and is also restless like arsenic, fine, and you know that, and the periodicity, and desires for fruits, then China arts can be a beautiful picture. Okay. So here China arts, only arts, Eupatorium, any other remedies you can think of. Huh? See, because the more you contribute, the more easy it will be for us. We can have an interaction, and we can also try taking up the comparative learning, which is very, very essential for a final year student. Okay. Now we'll come back. One of the girl has answered the right remedy. She has given you the right remedy. Now what I want to try to tell you is, next 30 minutes we will discuss a very simple remedy, at the same time very useful remedy. We use this very often in our clinics. As and when time permits, I will also share few of the cases. Okay. Now the remedy that we are going to discuss today is Eupatorium Perfoliatum. Okay, Eupatorium Perfoliatum. Now this is the remedy, and I gave you yes, a brief introduction that this remedy is predominantly indicated in fever. I will also try to tell you what type of fever, etc. And it's got a common name. Common name is bone set and thorough wart. These are two common names I got from the literature, and very important, it belongs to the family Compositae. As a final year student, you should know that there are group remedies, and the group remedies will have its own common characters. Okay. So which are all the other remedies from the Compositae family? Calendula, Arnica. Okay. Okay. I mean Calendula, Arnica, Chamomilla, Bellis. Okay, fine. So if you keep all these remedies in your mind, you see some common things. So we'll also look at what the common things are, and we'll try to go ahead. So Compositae is the family. The entire plant tincture is what we use in the preparation. Okay. So this is the introductory part. For a final year student, it's not very important, but this is important. It belongs to the family Compositae, because we are trying to integrate and understand which are all the other remedies and what are all the common things you also see in Eupatorium. This is important, bone set, because you see a little later that it's got something which makes or which gives the common name bone set. We will try to understand. I have taken the first paragraph of Dr. Borik's Homeopathic Materia Medica. I was reading and I felt it is very important. Every homeopathic student should know this in Eupatorium. So I thought I'll just cut paste and I'll show it to you. So we'll go slow, we'll read stepwise and we'll understand. In Dr. Borik's Materia Medica, in the first paragraph, this is what he says. Eupatorium is known as bone set from the prompt manner in which it relieves pain in limbs and muscles that accompanies some forms of febrile disease like malaria and influenza. Now what do you understand from the first two lines? What do you understand from the first two lines? If you have not understood, please read it. It's important, because our entire remedy theme, base, is on this. Okay? From the prompt manner in which it relieves pain in limbs and muscles that accompanies some form of febrile disease like malaria and influenza. So in fever conditions like malaria and influenza, when you have bad muscle pain or bone pains, this remedy promptly relieves the bone pains. Okay, that's why it is called as bone set. And he is also giving us the sphere of action. where exactly Eupatorium is acting. And from Borix Materia Medica, you see it has got an affinity for the gastrohepatic organs, bronchial mucous membrane. It is a boon in miasmatic districts along rivers, marshes, etc. and in all conditions where there is a great deal of bone pain. Cachexia from old chronic bilious intermittent diseases, worn out conditions from inebriety. See, inebriety means, any idea? English medium school students. See, like, a state of intoxication which comes after alcohol. A state of intoxication which comes because of alcohol. So, sluggishness of all organs and functions, bone pains, general and severe soreness, marked periodicity. This is what I was trying to tell you. If you just see in the brackets, both the remedies are there: arsenic, china, and of course cedron. Now, as a final year student, what is it? The periodicity that you have in cedron? Very good, beautiful, good, keep it up. Clockwise, clock-like periodicity. What do you mean by that? What do you mean by that? Symptoms will return at that particular hour. And so sure the patient is, he can show you the clock and he can tell, देखो डॉक्टर साहब, अभी 10 बज रहा है, and I will be starting with the symptoms. So clock-like periodicity, very prominent in syndrome. Okay. So we'll move ahead and we'll try to understand. Next 40 minutes I was trying to tell you, we are focusing on 3 important areas. Okay. And Eupatorium, from the introduction we got from Dr. Borik, from the case I shared, you know that it is a very good remedy for fever. So we'll try to explore the fever symptoms of Eupatorium. That will be our first objective. That is the primary objective. And the second thing is, apart from fever, whatever is left over, okay, the important PQRS, we'll try to cover that. The major chunk will be the fever, and the leftover we'll just see what other things you have in Eupatorium. And keeping the final years in mind, we'll also take up comparison. Okay. So you can contribute, and we'll try to have a small activity and we'll try to compare related remedies. Okay. So before I go into the drug, a small recap. So what is it that we are trying to understand today? We are trying to understand a remedy by name Eupatorium. Okay. And Eupatorium, its main affinity, you already saw Dr. Borik telling. Where do you see Eupatorium mainly acting? Joints, muscles, GI, very good. And GI again is very specific. He gives you 2 areas, stomach and liver. Stomach and liver. So, a remedy having an affinity for bones, a remedy having an affinity for muscles, a remedy having an affinity for stomach, a remedy having an affinity for liver, and the last thing you also see is it has an affinity. Any wild guess? Huh? Very good, beautiful. What made you think of occiput is, this is what that is highlighted. So a remedy which has an affinity for occiput. Occiput. Okay. So this is where you see this particular remedy acting. Okay. Now, the primary concern in Eupatorium, as a final year student, what is that you should know about Eupatorium is the fever. That's the first very important thing, and we'll also try to cover the other things. Okay. See, when I say fever, as a final year student, what are all those conditions in which you will see fever? Huh? You can give me some names as a medicine student. You can give me some conditions. Okay, very good. Typhoid, good. Malaria. And of late we are seeing a lot of dengue cases in Bangalore. Okay, so dengue, malaria, typhoid, good, possible. Huh? Okay, I mean fever because of the meningitis, encephalitis. See, this is very important, you should know. Okay, fine. Now why I am trying to insist on this is, if you read the source books, you don't see Eupatorium getting indicated for meningitis. Unless you have the Eupatorium picture, which I am going to give you. Okay. But generally, Eupatorium is not a remedy that is thought of for, meningitis. A better remedy for meningitis? Belladonna. Bell, Helleborus, and Cicuta. You have a lot of other remedies. So what I want you to understand is, a very good remedy for influenza. Okay. The seasonal flu, the viral flu that we have. Malaria, we already saw Dr. Borik talking high about Eupatorium in malaria. Dengue, what is it called? Break bone fever. And dengue is something, which is almost synonymous with Eupatorium. As a material teacher, I cannot give you synonym or equal, because our basic principle is similia similibus curanter. So whatever matches, the better we prescribe. But dengue picture matches very beautifully with Eupatorium. So go back home, read dengue and read Eupatorium, you see that it beautifully matches. Fine. But I am not giving you a formula that dengue is equal to Eupatorium. I am not giving you that formula. And you should also not believe in that formula. Dr. Hahnemann was against favorite remedies. Some later aphorisms he talks about favorite remedies. Dengue, okay, just looking at dengue, please don't give Eupatorium. It's against our principle. Fine. So see which is the remedy that matches the totality, and then you can prescribe. Viral fevers, influenza, malaria, rheumatic fevers. These are the conditions where one can think of Eupatorium. Or there can be many more conditions. But for me, any of these things, provided it covers the picture that I am trying to give you now. Hope I am clear. Hope you are getting the point that I am trying to tell you. See, it can be any of these diseases, or when the symptoms that I am trying to give you now, if it matches any fever, you can think of Eupatorium. Okay. So basically, from the image taken from Google, you see that this lady is suffering with fever and she is also having chills. Okay. So for a homeopath, when it is chills, lot of questions will come up. What are the common questions that will come up? Where is the chill? Location, very good. Fine. Time, when are you feeling cold? When are you better? When are you feeling more whatever? So first very important thing is the location. This is very important. In Eupatorium, the chills starts in the small of the back. What is it? Chills start in the small of the back. See, small of the back is more of the lumbar region. More of the lumbar region. So chills starting in the small of the back, one area, or it can, okay, now before chills, okay, fine. Anyway, now that we have started this, we will finish this. Chills begins in the small of the back, between shoulders. Between shoulders. Okay, there can be chills, or chills can be in the small of the back. Chills not better by heat. You are feeling cold, you are covering yourself, but you don't feel better. You still feel more chills. Okay. And before chills, see, this is also very, very important. I was reading source books few days back for your class, and many of the stalwarts, they say the patient is getting to know that he is getting chills because he has got a small indication, and what is that indication is he feels thirsty. So before chills he will have thirst, bone pain, throbbing headache, and feeling thirsty before chills. Very important. Okay. Chills in this particular remedy, Dr. Borik also, if you remember, he was talking about periodicity. Periodicity means something that is coming up at certain period. So chills between 7 to 9 am, chills with great thirst. Before chills also you will have thirst, and even during chills he is having thirst. Now this is the chill stage in Eupatorium. Hope I am clear. Because when you start comparing at the end of the class, when you talk of other remedies, this information will become very useful. So that you can accordingly compare the remedies. Okay? So this is the chill stage. Next, what is the next stage? You have the heat stage. So what happens during heat? So what is that is characteristic in Eupatorium is burning heat, bitter vomiting after chill or during heat, and heat with hardly any thirst. So when do you see thirst in Eupatorium? During chill stage. So during heat stage there is hardly any thirst and they feel greatly weak. Great weakness is what you see here. Okay, so moving further, what you also have in Eupatorium is intense headache, body sore from head to toe. Body feels sore from head to toe. This is also there. So this is all what happens in the heat stage. Chill heat, what is the last stage? Sweat. So the sweat in Eupatorium. See, sweat in Eupatorium is not very much marked. They are very scanty sweat, very little sweat. Okay. So sweating is scanty, and though it is scanty, the sweating relieves all the complaints. Meaning once he starts sweating, he feels better, but the only problem that is not getting better is headache. Headache not better by sweating. Headache not better by sweating. So we saw the indications of Eupatorium, Perfoliatum in the intermittent fever. Okay. Chill, heat, sweat. So with this, what are all the other things you have? Generally, Eupatorium is thirsty. I'll discuss in the further slide that they feel thirsty. And you saw the thirst is more prominent in the chill stage. And the characteristic thing in Eupatorium is thirst for cold water. What is it? Thirst for cold water. Okay. Thirst for cold water, this is very important. And we have verified in our clinics many cases where we are given Eupatorium mainly when there is fever with severe body pains. And if you want me to be more specific, bone pains. Sir, all the bones are aching. Fine? All the bones are aching. So we'll just look at the pain. Pain in bones as if broken, bone breaking pain, violent and aching pain. So bony pains are very, very characteristic of Eupatorium. See, and these remedies are very important because as a doctor tomorrow, if you can't treat a viral fever, and I am not able to treat a simple viral fever, fine? Okay, and these are those simple remedies which can make your practice, at least the initial days of your practice, very confident. You have an Eupatorium picture, you give Eupatorium and patient will be very happy. Sir, I have to take other remedies. If I take 5 hours, 6 hours, I am better. But after your remedy, no further episodes of fever. And that will also build confidence in the patient, and of course, it will also boost your confidence. Okay, so these are simple remedies, but you should know. And what is it that you should know in Eupatorium is, this is very important. If they don't have pain, then it is not Eupatorium. Please make a note. If they don't have pain, please don't prescribe Eupatorium and blame homeopathy. Okay, so this is the rule out point. No pains, no bony pains, fine, then it can't be Eupatorium. It can't be Eupatorium. Okay, so see, I told you it has an affinity for bones. You saw that it also affects the muscles. Many of the composite remedies, Which is the other remedy which has an affinity for muscles from the composite group? Arnica, very good. Myalgia. After exertion, you do some lifting, you do some exertion, you feel the muscles going into pain, myalgia. Okay. So muscles of chest, back, limbs are bruised and sore. The same feeling you also had it in arnica. We'll differentiate a little later, arnica from Eupatorium. Okay. Go with the flow, try to understand. And what is this gentleman doing here? He is moving. Now any wild guess, why is he moving? Why is he restless? Yeah, very good, you said restless, good. Why is he restless? Because of the pains. Body, there is severe pain. He wants to rest, he wants to sit. But sitting is not giving him relief. That is driving him out. Okay. But walking also will not relieve him. So, great restlessness has to move to relieve soreness, although motion does not ameliorate. Please read, very nicely written. He is feeling restless because of pains, he wants to move. But unfortunately, movement is also not giving any kind of relief. Okay? So this is with the pains and yeah, the moment I showed the picture, somebody also coughed, telling what exactly we are going to discuss. Cough in Eupatorium. You saw the sphere of action even on lungs. So it causes cough. And many times cough will be part of the viral fever. Okay. So when coughing, what is this person doing? Holding his chest. So which are all the better remedies? While coughing they hold chest, very good. Drosera, natron sulph, beautiful, keep it up, natron sulph. You missed simple remedies. Bryonia, very good. See, bryonia, when he is coughing, he holds it, because one thing is pressure ameliorates. Second thing is, he feels it is all, if he coughs, he feels it will all break. So as a protection, he is keeping his hand over his chest. So bryonia. One more remedy you should know is arnica. There are many remedies. I am giving you the top remedies. Arnica, bryonia, natron sulph, and of course this particular remedy. Holding throat while coughing. Allium sipper. Why? Yeah, they have a sensation when they are coughing, larynx will tear, so they have to hold the larynx, and you cannot hold the larynx, so that's why I am trying to tell you throat. External throat, they keep their hand here and then they cough. That is allium sipper. Holding head while coughing is again bryonia, and you have a rare remedy by name nicolum mint. Right? So holding head while coughing. Holding testis while coughing. The child holds his testis while coughing. Single remedy, and that remedy is zincum. So tomorrow if you are lucky in your clinic, you get a patient, an intelligent mother or father would have observed, sir, every time he is coughing, he is holding his testis. Fine? Okay? So all these things matter only in homeopathy. For other physician, what you hold, whom you hold, will not matter. But for us, see how delicate, how sensitive, how accurate you should be. So when he is holding his testis and is coughing, and mother says, and you don't give importance, you brush it aside, saying, everybody ಕೆಲವರು ಮಕ್ಕಳಂಗೆ ಮಾಡ್ತಾರೆ. But you'll be missing what? Zincum. A dose of zincum can do wonders. Done? So knowledge is something that is very, very important. And all those PQRS, only homeopathy can do wonders. Okay. So holding chest and cough aggravation 2 to 4 m. Cough aggravation 2 to 4 m. A better remedy? A commonly used remedy having this modality. Very good. Who is that? Louder. Yeah, remedy side, correct, very good. Calicar. Calicar. Okay. Cough has to sit up. Okay. Asthma, 2 to 4 aggravation. 2 peculiar modalities you have in Eupatorium related to cough. What is it? 2 peculiar modalities you have in Eupatorium related to cough. If you just see that hand and knee on the ground. Luckily, thanks to Google Images, otherwise I had to demo and I had to show it to you. Thanks to them. So this is what you have. Hands and knee. Fine. I mean, they are comfortable. One. And second very important modality you also have, they are getting on hands and knee, amelioration, cough. And this kneeling facing face towards the pillow. Kneeling with face towards the pillow. Only remedy in our materia medica is Eupatorium. Only remedy in our materia medica is Eupatorium. Kneeling with face towards pillow, I have written in brackets only, meaning single remedy. So when you have a patient with cough, see for the peculiarity, which position is comfortable. Okay, each of the patient, based on his individualistic thing, he can be better with a different position. Lying on abdomen. Remedies? Final year. Medorinum. Acetic acid. Ammonium carbon. Okay, fine. Sir, when I sleep, I don't have cough. Which is the remedy? Cough, better by sleeping. Manganum. Manganum. I mean, these are remedies you should know, Because tomorrow patients will come to your clinic with similar modalities and you should be in a position to understand, appreciate and prescribe. And once you prescribe, you will also see the follow-up, they beautifully improve. Okay. So this is with the cough and it can be part of the fever or they can come to you with cough alone as a symptom. And if this totality matches, you can think of Eupatorium. Okay. Now what else you have in Eupatorium other than fever? What is the remaining part in Eupatorium? See, one thing, many compositor family they have this, and that is soreness. What is it? Soreness. Body feels sore. Soreness. Okay. So like another compositor, Eupatorium also has soreness mainly in the eyes, soreness of the body. When he is coughing, the chest muscles feel sore. In fever, the entire extremity of the muscles can feel sore. Sir, very bad pain, sir. Sore pain, sir. Gaya adange no. When you injure yourself, no, the kind of pain you have, they will not allow you to touch. The entire body feels sore. Okay, many times people have this in viral fever. You can think of Eupatorium. And I was talking very high about this particular thing in Eupatorium. They are thirsty constitutions. Especially in acutes in fever, you see them having increased thirst, and thirst is mainly for cold water. Thirst is mainly for cold water. And one more important desire they have is ice creams. So during fever, somebody telling, sir, I feel like eating ice cream, and severe body pains. And if the picture is matching that of Eupatorium, you can think of Eupatorium. Okay? So these are few things. And yeah, this is what we had missed. What is it? Occipital headaches. Occipital headaches. There are many remedies, better remedies, but think of Eupatorium. Occipital headaches, what is very peculiar is headaches which are having a periodical occurrence. Headache every 3 days, headache every 7 days. That is the periodicity you have in Eupatorium. So headache 3rd and 7th day, and headache better by conversation. Headache better by conversation. Okay? And nausea. Nausea at the smell of the food. Nausea, smell of the food. Okay? So these are few things you have in Eupatorium. we'll try to recap the key points, and I'll give you the modalities as well. See, headache better by conversation. One more remedy. Dull camera. Headache better by conversation. When they're conversing, no, headache is better. Dull camera. So modalities, you know, all these are aggravating factors, and amelioration, you know, lying on face, vomiting, sweating, conversation. Sweating does not relieve one complaint, which is that headache. Good, headache. Okay. Otherwise, you see all these things are aggravating factors. You saw the periodicity, chills coming at what time? Chills coming at 7 to 9. What is coming between 2 to 4? Good. Cough is between 2 to 4. Okay. And chills is between 7 to 9. 7 to 9. Okay. And we saw third, seventh day aggravation. So these are all the modalities. Now the last and interesting part will be the comparison. Okay. So if you want it to be interesting, you will have to contribute, and you can either give the remedies or you can give the essence or PQRS of those similar remedies. First question, did you get a clarity of Eupatorium? Did you get a picture of Eupatorium? So what is Eupatorium all about?
Fever.
Fever. And what type of fever? Huh? When you have predominantly bone pain, every single bone, every single muscle aches, and because of this pain, what is the person doing? He is becoming restless, he is not able to sit. At the same time, movement is also not giving him any kind of a relief. Okay. And we also saw vomiting with fever, and we also saw increased thirst. Okay. Chill stage, heat stage, sweat stage. Okay. And then the desires mainly for ice creams, cold things. Okay. And that bone break fever is what we are trying to understand. Okay, that periodicity, all those things. Now keeping this in mind, what are all the similar remedies that you can think of? You can start. What are the remedies you can think of? Okay, somebody is starting with gelsemia. Very good. Gelsemia. Now what is it? When do you think of gelsemia? Okay, intermittent fever, very good. Agreed? Okay, the onset in gelsemia is slow. And where do you see the chills? In Eupatorium you saw chills between shoulder, and in gelsemia you see chills going up and down the spine. Okay, so a lot of chills, bad chills, and chills mainly in the back, in the spine. Okay, and what else? Okay, is gels restless? Okay, thirstless, very good. So Eupatorium can be thirsty or thirstless, but gelsemia is 100% thirstless. Very good, appreciate. What is that key factor in gelsemia?
Dizziness, drowsiness.
Very good, drowsiness. Drowsiness. More than drowsy.
Tremors.
More than tremors. More than all that, you know, drooping of the eyelids. Okay. Many times you can either see drooping. For me in my clinic, this is very important. Without this I don't give gelsemia. Or at least they should tell heavy. Eyes feel heavy, you know, they come like this to clinic with fever. Eyes are very, very heavy. Kan tige kaktala. Doctor kannu. Bara. Kannu bara. Heaviness of the eyelids. That is the ruling point of gelsemia. Without that it can't be gelsemia. Okay. Very good, gelsemia. Somebody was talking of arnica. How is it in arnica?
So,
Arnica is also composite. Arnica also has soreness. But how is arnica different from Eupatorium? Huh?
every part
Okay,
is hard.
I mean, part feels hard. The soreness, the restlessness is in search of soft place. Okay, fine, they keep searching for soft place, one thing. And again, you have a beautiful phrase in arnica. What is it?
Delirium.
I am fine. I am well. Though he's got 104, 105 fever, he says, hey, doctor, no problem illa. Nan aram. But the thermometer and your body, your temperature, that is not telling. But arnica patient feels, I am well. Delusion well is. Delirium well is. He says, doctor, I don't need you. I don't need treatment, I am fine, absolutely fine. Okay? And you are also talking of the delirium. How is it in arnica? Delirium, you don't see delirium in Eupatorium, but you have delirium in arnica where they answer your question correctly and then they go back to sleep. Yes or no? Okay, good. Any other remedy that comes close?
Baptism.
Baptisia. Okay, see, baptisia is more of typhoid. And you know, baptisia, there is so much of toxicity, blood poisoning, high fever leading to a delirious state. 105, 106 fever leading to a delirious state. You don't have so much of body pains, you don't have so much of bony pains like you had in Eupatorium. Alli it's more of bad breath. Okay, the tongue which is coated brownish, restless, delirious, is collecting his own hand leg. Sir, nan kaalallide, nan kaide, ba kai, kaal ba. He is trying to fix himself. Fine. So it's a different state you have in baptisia. High fever. Okay. Bryonia. You know, whenever we talk of pains with fever, a remedy which comes very close to Eupatorium is bryonia. How is bryonia different from Eupatorium? How is bryonia different from Eupatorium? Both of them have thirst. Bryonia is hot. Bryonia is again an insidious onset, and in bryonia you will have excess sweating. What is it? The sweating in bryonia is too much when compared to Eupatorium. Character of sweating in Eupatorium? Joragi, scanty. In bryonia it is profuse sweating. And what is the other important difference between Eupatorium and bryonia? What motion? Here you are seeing him moving around, restless. How is bryonia? What our Kent says, he is like a log. He is lying like a log. He is just lying, does not want to be disturbed. If you disturb him when he is lying, then he becomes angry. Anger when obliged to answer is bryonia. Amma, disturb madbadamma, malgidini. Jwara ashtu gottagalla ninge. Fine? And he again goes back to sleep. Okay? So bryonia lies down like a log. But what is Eupatorium doing? Because of these pains is restless. What is arnica doing? He is searching for a softer place. What is restox doing? He is moving. Because if he is moving, he feels better. The moment, jwara bandida sumne kootkolo, if he tries to sit, he can't sit. His complaints aggravate. So each remedy will have its own beauty. Never use the word confusion. Fine, you should be blessed. We have so many remedies. Okay? And you should know when to prescribe a remedy based on the totality. So arnica natrum here also comes very close. Natrum also has vomiting during fever, which you have in Eupatorium. But natrum for practical purpose is a heart patient, and natrum ailments are also something different. Many times it can be an emotion, some grief, some loss, which can bring in bodily symptoms. That might be missing in Eupatorium. Okay?